Hi. Do we need to do that stretch thing? That was pretty effective for me. Was it good for you? We just did it. We don't need to do it. My name is Jamie Lagarde with Sedera. Hey, the Sedera folks who are here, will y'all raise your hand? Traveling with me is a lot, so I just want to thank them for coming with me on this trip. I'm really excited to be here in front of you to talk about what Sedera is doing and why we love direct primary care so much. This video, I think, when I'm trying to describe what sharing is, yes, this video for me, I'm kind of obsessed with this video. Our head of client services, Dania Heffington, who does a great job, her and her team are amazing. She found this video, and I'm mesmerized by it. Let me play it for you. It's really short. Oh, let's try that again. Oh, the clicker won't let me do it. Folks, that's sharing. That's what it's about. Someone's got a need. We come together as a community and help them. That's what it is. And this goes on, and we don't need to watch the rest of it. But maybe we can move beyond that slide. I mean, I really like it, but we don't need to watch it that many times. There we go. What is Sedera in that picture? We're the guy hitting the side of the house. That's what we are. We're facilitating the community coming together to support each other. So here is our vision. This is what we're about. We are about trying to make high-quality, human, transparent solutions the new normal in healthcare. We do this by promoting individual ownership, direct access, and a sharing community. So I think, and we got a little bit of that's supposed to say 2005. I think there's something going on in healthcare that we can relate to that's happened in transportation. In 2005, when we needed to get around, there were cars, there was taxis, and there was forms of mass transit. That's it. Those were the main ways to get around. But now in 2019, almost 20, there's all these other options that are available. We have Uber, we have Lyft, we have scooters, we have Lime, we have all sorts of other options that weren't available. It doesn't mean the current options aren't there. Still from 2005, they're still there and they still serve a purpose, but people have more options based on what they need. And that's what we think is important in healthcare. People need more options to choose from, not less. And so what's happened in transportation, we see this happening in healthcare. Love what Nick and the Decent team are doing. That's an insurance approach. It's a different way of doing it. Sharing, the sharing ministries, that's a different way of doing it. We're a sharing organization, and I'll talk about what makes us specifically different. But you know, when you think of telemedicine, you think of direct primary care, you think of virtual direct primary care, you think of expert second opinion services. These are all solutions to provide people the health care they need without any insurance in it. People need options. This graph just shows, and this is data from the KFF, Kaiser Family Foundation. You can see on this that, you know, in a period of time since 2008, wages have increased 19%. The premiums have increased in that period of time in insurance 55%. But the employees' portion of this has increased 70%. We refer to this at Sedera as the unsustainable squeeze. Something has to change, and that's one of the reasons why we're all here. This, to me, is something that we are very focused on as well. There is something special between the relationship between a patient and their doctor. And who are we to get in between of that? One of the things that's important with us, and let me back up for a second and say what exactly Sedera is. I don't think I said that. We're a medical cost-sharing organization that's focused on serving everyone. It's not a matter of faith. We see this sharing in the sharing communities. They're wonderful organizations. The first one started in 1981. They're serving, the new numbers are not out yet, but if I had to guess, don't hold me to this, 1.2, 1.3 million people today. It's got a track record, decades of success. Every eligible need has been fully shared with these organizations, the ones that I recommend and big fans of. Sedera, we take care of our members. No one is left wanting. No one's dealing with balanced bills, for example. But this solution works, and it shouldn't be a matter of faith. So for Sedera, we said, let's make this available to everyone. And number two is 180 million people get their healthcare today through employers. Why aren't we making this option available for them as well? Specifically small employers, that the great self-funded arrangements that we've been hearing about, which are fantastic for large groups, and in some cases smaller groups, but they get to a certain size where that methodology doesn't apply. So Sedera, we think when we're for our product, what we're focused on is small groups and individuals. That's our focus. That's who we're trying to serve. And we do not want to jump in between we don't want to jump between the doctor-patient relationship. So kind of the slogan is, we all need access to healthcare, but health insurance is just one way to pay for it. So as a summary of what we are, every member is a cash pay patient with Sedera. We're focused on people and community rather than numbers. This is a community solution of people coming together. Like I talked about before, it's got a proven track record of success going back to 1981, well over 30 years. There is freedom from network. So we don't tell our members where they can go. There's no in-network, out-of-network concerns with Sedera. Ultimately, the choice is them, hopefully working with their DPC doctor about what they do. Now, we get involved to help negotiate bills behind the scenes. And we may give people incentives to try to, hey, consider this option. I'll give you an example. We had a member who had a hernia in North Carolina, and they called up and they shopped around their area, and the price they got was $25,000, $30,000 all in for a hernia repair. And we called them up and we did our research, and we said, I tell you what, this was 2 years ago. And we said, we will fly you and a friend in to Austin, Texas. We'll put you up at a 4+ star hotel where you'll see one of the best general surgeons in town at a surgery center, stay a couple of days to recuperate, have a fun time in Austin, and fly back home. We covered all their incidentals. We would cover all their incidentals in this offer. They would have zero out-of-pocket costs for this. Anyone want to guess how much that cost? Someone, 5? 8? Split the difference between the two of you. It was about $7,000 covering all those costs. So as a community member, and again, we're doing this on behalf of the community. Remember, we're only the hand hitting the side of the wall and trying to make sure that the community is healthy. It made sense for us to remove every bit of out-of-pocket cost for them. Now, they ended up not taking that offer, but they found an $8,000 surgery about 30 miles away in South Carolina at the time. So part of what we are doing, and part of what you all are doing, is educating people about how to be buyers of healthcare like they are about in every other sector of their economy. Like when you go to the grocery store and you're looking at this soap, and you smell it, and you read the label, and you see the price, and you make a decision, you put it in your grocery cart, and you go. And if we can figure out our cell phone folks at the Apple store and figure out which one we want, we can figure out how to buy healthcare. It's not that hard. Yes, healthcare is incredibly complicated, and the work that the physicians in this room are doing is awe-inspiring. But to purchase healthcare and to be a buyer of healthcare, from our perspective, and yes, admittedly we're biased, we need people to be involved in the purchase of healthcare and not turn it over blindly to a third party. We need them involved. So freedom of networks, we look and so the final point I would say is, look, we are a healthy lifestyle community. We've got a very open, I think we've got as time has gone on, we've gotten more and more open with our pre-existing condition rules, and we want to see that, especially with our small employer groups, continue to open that even more. I like to say Sedera works for 8 to 9 out of 10 people. Today it doesn't work for 10 out of 10 people. We'll see what happens in the future. This is the growth of the healthcare sharing world as an industry since the Affordable Care Act was passed in 2010. Again, you're seeing data from 2017. It's a larger number now. I can't wait for them to release the statistics, but I don't have that yet. But again, I'm estimating about 1.2, 1.3 participants. This is what a need and how a need works. That's a special term with Sedera. We define a need as one or more medical expenses caused by a single accident or illness. So you have an initial unshareable amount, what we call the IUA. It is how much you pay before sharing begins. So since time is short, I'm going to give you an example. And you have various IUAs, your membership type, and you pick what makes sense for you. So in this example of an ear infection, this was just Sedera by itself compared to an insurance plan. This was my son Brooks, and then the medical cost sharing was what it would, I paid $2,500 to put tubes in his ears, where with medical cost sharing, I would have said $500, and the rest would have been fully shared with the community. So on the final slide, the three components, when we look at healthcare, we look at it as big buckets of large cost, small cost, and preventative care. We feel like direct primary care works really well for us. One of the last points I'll leave you with is that direct primary care, we changed our program to work well with direct primary care. The three, if you know the MEC, minimum essential coverage, it's the colonoscopy, the mammogram, and childhood vaccinations that in many cases are not part of a direct primary care practice. Sometimes the childhood vaccinations are, but we will share that at a zero IUA, meaning it's fully shared with the community. The reason we're doing this is we made this change to fit better with the direct primary care. Last point, on pricing, how do we work? We don't get involved in how you charge your member. We don't want to get involved there. So if they have a direct primary care membership, we lower our rates. That's what we do. So we have one nationwide rate structure. You have a direct primary care practice relationship, your membership with Sedera goes down. And if you leave them, we're going to raise your rates. So keep your direct primary care practice. Thank you all very much.